This is part 3 of 4 on chapter 13, and we're looking at microbe and human interactions. So in this part of the chapter, we're going to be looking at different types of infections and where infections can be picked up from and how they can be transmitted from person to person or person to animal and so forth. So a little bit more detail about infectious diseases. So there's different patterns of infections. So if we look on the left-hand side, you can have localized infections where they're just in one spot, or you can also have systemic infections, like an influenza, for example, that travels to multiple parts of the body and can affect multiple types of tissues and multiple organs. You can also have focal infections, where the infection starts in one part of the body and then it can travel to another part, but it doesn't travel everywhere like the systemic infection can. Other patterns of infections, we can have mixed infections that are caused by various types of microorganisms shown on the left. You can also have primary infections, which is caused by one type of bacteria, and then that one bacteria causes more problems. You can get a secondary infection on top of your primary infection. So, for example, a urinary infection could lead to another secondary infection, some type of vaginal infection that's close to the original area that had an infection. So these different patterns of infections, you can also classify them based on acute. So acute infections, they come on rapidly, they have really severe but short-lived effects to them. So this is when you get sick very, very fast. Whereas chronic infections progress and persist over a very long period of time, and it could be weeks or months or years for the chronic infections. In addition to different patterns of infections, diseases can have different signs and symptoms. And the difference between a sign and a symptom, a sign is something that you can actually measure or observe. So a good example of a sign is like a fever. You can actually measure if someone has a fever or not. Septicemia, you can measure and see if there's bacteria that has traveled to different parts of the body. You can collect samples to look at microorganisms to see where they're found in different tissues. You can look at breathing rate, if there's swollen lymph nodes, so things that you can actually measure and feel and collect data on. A symptom of a disease, this is something that you cannot measure in any way. It's just the person has to tell you that they have these symptoms. So for example, chills. Chills you can't measure. The person has to actually tell you, or if they have any pain anywhere, nausea, fatigue, itching, headaches. So anything, again, that you cannot really measure is called a symptom. So the earliest symptoms of a disease result from your body ramping up its host defense mechanisms. So these are things like fever, pain, soreness, swelling. These are things that your body's just automatically going to do when it senses that there's some type of invasion that it needs to fight off. Signs of inflammation, you can have edema, which is accumulating fluids in parts of the body. Abscess is a wall of collection of inflammatory cells and microbes. Lymphiditis, this is what they call the swollen lymph nodes. So you can have, again, symptoms are things that you cannot measure. The person has to tell you. Signs of an infection, these are things that you can measure, you can observe on the person or animal. So other signs of an infection, specifically in the blood, you can collect blood and look at the number of white blood cells that are circulating in the blood. Leukocytosis, this is when there's an increase in white blood cells in the sample, and that usually indicates there's some type of infection. Or leukopenia, that's a decrease in the white blood cells in your blood. Septicemia is when you find microorganisms that are multiplying in your blood sample and they're present in really large numbers. And different types of septicemia, if it's bacteria, bacteremia, small numbers of bacteria that are present in the blood. They don't necessarily have to be multiplying, but usually don't want bacteria in the blood. That's bad. It means the bacteria can travel to other parts of the body. Same with if you have viruses present in the blood. They don't necessarily have to be multiplying, but it means the viruses can travel throughout the body through the blood. Some infections can actually go unnoticed, and these are called asymptomatic or subclinical infections. So you can have an infection, but the host, that person or animal, doesn't show any signs of the disease. And the person is usually not very aware of this infection either, so the person doesn't usually seek medical attention. So a lot of these infections, they won't get data collected on them in the epidemiology part of your clinic. So if a person has an infection and they're treated for it, just the apparent recovery of the host, it doesn't always mean that the microbe is completely gone from that host. Some infections, they have a latency period. So after the initial symptoms of a chronic disease, that microbe can periodically become active and produce a recurrent disease. So some microbes, specifically some viruses, they can actually hide in the host body, and then they'll just show up when that host is stressed out or during certain times in that host's life cycle. You can also have long-term or permanent damage to tissues or organs due to these chronic diseases. Microorganisms that can cause infection are picked up from different sources. So all microbes, they have a reservoir. This is the primary habit where that pathogen just naturally lives. It could be in a human, or a lot of times it's in an animal, soil, water, plants. So this is where that microbe just normally lives. And then this reservoir, it could also be a source, but the source of your infection is the individual object from which your infection is actually acquired. So if someone goes out and touches some soil that has a pathogen in it, and then they touch another person, the reservoir is the soil, but the source of the infection is actually the person that's passing it on to other people. Living reservoirs, some individuals are said to be carriers. These are individuals who shelter a pathogen and they can spread it to others, but they don't necessarily have to show any symptoms of the disease, although they could show the symptoms of the disease. A chronic carrier is just a person that has a latent infection, so an infection that's hidden, and they actually are still shedding that infectious agent, so other people can pick it up. Asymptomatic carrier, this is when the person doesn't have any symptoms of the disease, but that microorganism is still inside of their body, and they can still pass that microorganism on to other people. And then a passive carrier, which is shown in the image here, this is when you have a contaminated healthcare provider, picks up the pathogen, and then transfers it to another patient. Passive carrier is really bad. So you want to make sure that you're not going from one patient to the other without washing your hands or taking care of certain things. You don't want to use the same equipment on one patient that you use on another patient without sterilizing it or making sure that it's clean. You can also have incubation carriers. This is where the person can spread the agent during the incubation period. So before they actually have any signs or symptoms, they can still get other people sick. Convalescent carriers, this is when a person is starting to recover, but they can still pass on that infectious agent to other people. So besides people being carriers, we also have animals that can be reservoirs or sources of pathogens. So a live animal, any other animal other than human, that can transmit an infectious agent from one host to another is called a vector. Most vectors that we think of are arthropods, so like fleas, ticks, mosquitoes, flies. These things can transport pathogens from one mammal to another. Some of these vectors are called biological vectors. So these biological vectors, they participate in the pathogen's life cycle. They're essential for that pathogen to be living. Whereas other types of vectors are just mechanical vectors, where they're not necessarily to the life cycle of the pathogen. The mechanical vector merely transports it from one host to another, and that vector is not infected with the pathogen that it's transporting. So some special types of infections that are endogenous to animals, so they're usually found in animals, but they can be transmitted to humans. This is called a zoonosis infection. So this is one that comes out of animals and can be transmitted to humans. Humans cannot transmit the disease to each other. They can only get it from an animal. And there's about 150 of these diseases worldwide. 70% of these are emerging diseases, so ones that we should be careful of, because if they mutate, then they could go from human to human. So think of the avian flu or bird flu is a really good example of one of these. So the bird flu normally just gets passed from one bird to another, but every once in a while it gets passed to a human. That human, it gets sick, but they're not able to get other humans sick unless that flu virus actually mutates. Then it could become an emerging disease and spread throughout the population. These types of infections, they're really impossible to eradicate without getting rid of that animal that the pathogen is normally found inside of. Acquisition and transmission of infectious agents. So some diseases are able to be passed on from one host to another very easily. So these are communicable diseases. So that's when an infectious host can transmit the infectious agent from another host to another host and establish infection in that host. So basically, this disease can be passed on from one person to another, one animal to another. Diseases that are easily passed on are considered to be contagious diseases. Other infectious diseases, the non-communicable diseases, they do not arise through transmission from one host to another. These ones are usually the endogenous infections, so they occur primarily when you have a compromised person, so immunocompromised, their host defense system is down, and they actually infect themselves. So this immunocompromised person is invaded by his or her own normal flora. So again, it's an endogenous infection. Or they can get it from contact with an organism in its natural environment, or they can get it from a non-living reservoir. So different patterns of transmission, so how these infectious agents can be passed from one person to another. So it can be passed by direct contact, so that's physical contact, or if you have fine droplets spreading through the air, that's direct contact. Usually this is done by touching one person, so you're directly contacting each other, physical contact. Indirect contact, this is when it passes from an infected host to an intermediate object and then to another host. So these are considered to be vehicles or inanimate objects, such as door handles or paper, pencil, pens, food, water, biological products. The fomites, those are inanimate objects. It can also be airborne, so if water droplets are coming through the air, they could get breathed into a host, and then you can end up with some type of infection. So here are different ways that you can acquire infectious diseases. So more examples over here to kind of help clarify this a little bit. So on the left-hand side we have direct transmission. So kissing, sex, for example, droplets, so sneezing, coughing can be help to spread colds or chickenpox. There's vertical, where a mother can pass it on to her unborn child. Biological vectors, that's another type of direct contact. On the right-hand side, we have indirect ways you can pick up diseases, so the fomites, like the door handle, for example, inanimate objects, food, water, biological products, so E. coli, salmonella from meat or eggs, or you can breathe in particles through the air, so just droplets from the air, they're hanging on water droplets in the air, or dust gets kicked up into the air and you breathe it in. That's an indirect transmission. In addition to these types of infections, we also have what are called nosocomial infections, or I think they actually changed the name. They're called hospital-acquired infections now, so HAI, hospital-acquired infections. These are diseases or infections that a patient acquires and develops during a hospital stay. So these hospital-acquired infections are very bad. It's usually due to the hospital staff not cleaning things like they should, not taking care of the patient like they should. And most of the time, these healthcare-acquired infections, you have urinary tract infections are a big one from catheters. You can get lower respiratory tracts. Surgical wounds can very easily get infected if they're not cleaned and taken care of properly. Blood infections, skin infections are a little more rare, and then other infections account for the rest of these. So again, these infections are really bad. You want to actually prevent these healthcare-acquired infections because you're actually getting your patient more sick than when they came into the hospital or into the clinic. So in order to cut down on these healthcare acquired infections, we have really stringent measures to prevent the spread of these nosocomial or healthcare-acquired infections from. They can go from one patient to another, from a patient to a healthcare worker, or from healthcare worker to a patient. So these really stringent measures are called universal precautions. And the biggest universal precaution is washing hands. So that's a really, really big one. Besides that, you're given gloves, you can wear a mask depending on the patient, what kind of disease they have. That kind of tells you what types of precautions you should take if you have to wear a gown when you're working with a patient. So the universal precautions, the main lowest level precautions, we just base this so we have to assume that all patients' specimens harbor some infectious agent. So when you're working with a patient in your clinic, in the healthcare setting, just make the assumption that they're infectious and treat every patient with the same amount of care, because you never know when they first come in what they might have. You might have some guesses, but just assume that you need to be really careful. And again, hand washing is the number one universal precaution. So make sure that you wash your hands between every patient or between every procedure that you do.